Module 6, Noise Exposure and Vibration. Question 1. Noise can damage your hearing. What is an early sign of this? A. There are no early signs. B. Temporary deafness or ringing noise in your ears. C. A skin rash around the ears. D. Ear infections. The correct answer is B. Temporary deafness or ringing noise in your ears. Question 2. After working with noisy equipment, you have a ringing sound in your ears. What does this mean? A. Your hearing has been temporarily damaged. B. You have also been subjected to vibration. C. You are about to go down with the flu. D. The noise level was high but acceptable. The correct answer is A. Your hearing has been temporarily damaged. Question 3. Noise over a long time can damage your hearing. Can this damage be reversed? A. Yes, with time. B. Yes, if you have an operation. C. No, the damage is permanent. D. Yes, if you change jobs. The correct answer is C. No, the damage is permanent. Question 4. How can noise affect your health? Give 2 answers. A. Headaches. B. Ear infections. C. Hearing loss. D. Waxy ears. E. Vibration white finger. The correct answers are A and C, headaches and hearing loss. Question 5. You think the noise at work may have damaged your hearing. What should you do? A. Plug your ears with cotton wool to stop any more damage. B. Nothing. The damage has already been done. C. Go off sick. D. Ask your employer or doctor to arrange a hearing test. The correct answer is D. Ask your employer or doctor to arrange a hearing test. Question 6. Someone near you is using noisy equipment and you have no hearing protection. What should you do? A. Ask them to stop what they are doing. B. Carry on with your work because it is always noisy on site. C. Leave the area until you have the correct personal protective equipment. D. Speak to the other person's supervisor. The correct answer is C. Leave the area until you have the correct personal protective equipment. Question 7. If you wear hearing protection, it will A. Stop you hearing all noise. B. Reduce damaging noise to an acceptable level. C. Repair your hearing if it is damaged. D. Make you hear better. The correct answer is B. Reduce damaging noise to an acceptable level. Question 8. If you need to wear disposable earplugs, how should you insert them so they protect your hearing from damage? A. Only put them in when it starts getting very noisy. B. Only ever insert them halfway into your ear. C. Roll them up and insert them as far as you can while pulling the top of your ear up to open up the ear canal. D. Fold them in half and wedge them into your ear. The correct answer is C. Roll them up and insert them as far as you can while pulling the top of your ear up to open up the ear canal. Question 9. 2 recommended ways to protect your hearing are by using A. Rolled tissue paper. B. Cotton wool pads over your ears. C. Earplugs. D. Soft cloth pads over your ears. E. Ear defenders. The correct answers are C and E. Earplugs and ear defenders. Question 10. As a rule of thumb, noise levels may be a problem if you have to shout to be clearly heard by someone who is standing. A. 2 meters away. B. 4 meters away. C. 5 meters away. D. 6 meters away. The correct answer is A. 2 meters away. Question 11. You need to wear ear defenders, but an ear pad is missing from one of the shells. What should you do? A. Leave them off and work without any hearing protection. B. Put them on and start working with them as they are. C. Do not work in noisy areas until they are replaced. D. Wrap your handkerchief around the shell and carry on working. The correct answer is C. Do not work in noisy areas until they are replaced. Question 12. If you have to work in a hearing protection zone, you must A. Not make any noise. B. Wear the correct hearing protection at all times. C. Take hearing protection with you in case you need to use it. D. Wear hearing protection if the noise gets too loud for you. The correct answer is B. Wear the correct hearing protection at all times. Question 13. Why is vibration a serious health issue? A. There are no early warning signs. B. The long-term effects of vibration are not known. C. There is no way that exposure to vibration can be prevented. D. Vibration can cause a disabling injury that cannot be cured. The correct answer is D. Vibration can cause a disabling injury that cannot be cured. Question 14. What are 3 early signs of vibration, white finger or hand-arm vibration syndrome have said? A. Temporary loss of feeling in the fingers. B. Fingertips turn white. C. Rash on fingers. D. Tingling or pins and needle sensation in the fingers. E. Blisters. The correct answers are A, B, and D. Question 15. Hand-arm vibration syndrome, CHI-VS, can cause A. Skin cancer. B. Skin irritation like dermatitis. C. Blisters on your hands and arms. D. Damaged blood vessels and nerves in your fingers and hands. The correct answer is D. Damaged blood vessels and nerves in your fingers and hands. Question 16. You have been using a vibrating tool. The end of your fingers are starting to tingle. What does this mean? A. You can carry on using the tool, but you must loosen your grip. B. You must not use this tool or any other vibrating tool ever again. C. You need to report your symptoms before they cause a problem. D. You can carry on using the tool, but you must hold it tighter. The correct answer is C. You need to report your symptoms before they cause a problem. Question 17. What is vibration white finger or hand-arm vibration syndrome, HAVS? A. A mild skin rash that will go away. B. A serious skin condition that will not clear up. C. Severe frostbite. D. A sign that your hands and arms have or are on the way to being permanently damaged. The correct answer is D. A sign that your hands and arms have or are on the way to being permanently damaged. Question 18. Which of these is most likely to cause vibration white finger? A. Handsaw. B. Hammer drill. C. Hammer and chisel. D. Battery-powered screwdriver. The correct answer is B. Hammer drill. Question 19. You are likely to suffer less from hand-arm vibration if you are A. Very cold but dry. B. Cold and wet. C. Warm and dry. D. Very wet but warm. The correct answer is C. Warm and dry. Question 20. If you need to use a vibrating tool, even for a short time, how can you help reduce the risk of hand-arm vibration? A. Do not grip the tool too tightly. B. Hold the tool away from you at arm's length. C. Use more force. D. Hold the tool more tightly. The correct answer is A. Do not grip the tool too tightly. Question 21. If you have to use a vibrating tool, what would you expect your supervisor to do? A. Measure the level of vibration while you use the tool. B. Explain the risk assessment and the safest way and length of time each day that you can use the tool. C. Watch you use the tool to assess the level of vibration. D. Help you to make up your own safe system of work. The correct answer is B. Explain the risk assessment and the safest way and length of time each day that you can use the tool. Question 22. If you have to use a vibrating tool, how can you help reduce the effects of hand-on vibration? A. Hold the tool tightly. B. Do the work in short spells. C. Do the job in one long burst. D. Only use one hand on the tool at a time. The correct answer is B. Do the work in short spells. Question 23. What should employers provide if noise levels are consistently high? A. Earplugs only. B. Hearing protection and health surveillance. C. Nothing, as noise is temporary. D. Louder tools to drown out noise. The correct answer is B. Hearing protection and health surveillance. Question 24. Which tool is least likely to cause hand-arm vibration? A. Pneumatic breaker. B. Angle grinder. C. Manual screwdriver. D. Vibratory roller. The correct answer is C. Manual screwdriver. Question 25. Why should you report symptoms of noise-induced hearing loss early? A. To get compensation. B. To prevent further damage and get appropriate help. C. To change jobs immediately. D. To avoid wearing protection. The correct answer is B. To prevent further damage and get appropriate help. That's all 25 questions for Module 6 on noise and vibration. Thanks for watching. Visit wardtraining.co.uk to get your Level 1 Health and Safety qualification. Next up, Module 7.